So we had talked about ICD codes in the last class. So ICD codes are basically the diagnosis codes. So whenever we treat any patient, we always look for the diagnosis. Okay? But diagnosis is not the only thing in a treatment. There are many things. There are services, treatments, we take the history, if any labs or any diagnostic test is asked for, that is there. In the treatment, when we talk about treatment, there could be uh, minor surgeries, major surgeries, and when we talk about surgeries, obviously anesthesia also comes into picture. Okay? So all these treatment services, history, all this comes in the CPT code. So CPT is current procedural terminology. That's the full form. Again, CPT coding exam is also timed. Okay. When you give a CPC exam, you will have CPT codes also and ICD codes also, which will be asked. So CPT codes are usually carrying the maximum percentage of questions. Okay, so maximum weightage is on the CPT codes. It is timed. Obviously, every exam has to be completed during a specified time. And there are multiple choice questions. Many CPT exams allow the use of official coding manuals, but understanding guidelines and code lookup efficiency is essential. Now there is thousands of code. Okay? It's not humanly possible to by heart all of it. Okay? So we have manuals of ICD, CPT codes, HCPCS codes also. So it's a very thick manual. It's not humanly possible to memorize each code. But there are the codes are there in certain chapters. Okay? So how to look up those codes? Okay? Now we already spoke that it is timed. The exam is timed. Okay. So if you are taking 10 minutes to search one code, you will not be able to complete in 3 hours time or 4 hours time. Okay. So when you want to search for the code, you should know exactly which, first of all, what is the service about, or the treatment or diagnosis, whatever it is, what is it about, and which chapter you are supposed to look into. Okay, that will only happen when you also are thorough with your understanding of medical terminology and anatomy. Okay? So that is what is actually taught in your uh, course, medical coding course. Success depends on applying correct CPT codes, using appropriate modifiers, and following coding conventions accurately. So that is what I just now spoke. Understanding first what is written in the medical note, okay, correlating with your knowledge of medical terminology and anatomy. Then understanding where you will be able to find that. Okay, so that ways only you will be able to search the codes faster and appropriately. So this is the process of coding. First, you need to assess what is there in the medical charting. Okay. Then you have the pre-coding requirements. You need to be aware of the latest modifications in the coding systems, both ICD, CPT, HCPCS. Okay. And also if what is the insurance of the patient and what are the requirements. Then when you have all these in place, you do your actual coding. Okay, you do your actual coding. And then when you have done with the coding, you have selected your CPT and ICD. If required, HCPCS. Okay, when you are done with all this, then your codes, your document where you have selected all the codes goes for quality audit. Okay, so if you have seen 10 patients, all the 10 patients will go for quality audit. They will verify whether you have done the coding appropriately, there are no mistakes, and then finally it is submitted to the medical billing department. So now categories of CPT codes. When we talk about CPT code manuals, again, there are three categories: Category 1, Category 2, and Category 3. Category 1 is the actual CPT codes. Okay, so all your whatever you have seen in the history of the medical of the patient, or what is there, whatever is there in the medical chart note, the investigation, diagnosis, whatever, surgery, everything, anesthesia, everything will be there in Category 1. Okay, so Category 1 again has 6 chapters. So you have evaluation in medicine, evaluation and management, sorry, evaluation and management. Second is your medicine, surgery, anesthesia, your radiology, pathology, radiology and pathology. Okay. So these are the 6 different chapters you will be seeing in your CPT course. Category 1. Okay. So what is there in category 2? Category 2 is basically performance management or performance measurement codes. Okay. And these codes, now CPT codes are usually in numericals. Okay. Only numericals are there in your CPT code. Some places you might have a alphabet. Okay. But usually it is comprising of all numerals. In category 2 also you will be having numerals, but the fifth letter will be a F. Okay, so the first 4 will be numbers and fifth position will be letter F. Okay, so whenever you have like 1001F, that means it is in the category 2 code. Okay, so that is how you understand the exam. What is a performance measurement? It's just a understanding of the quality of your services. Okay, so category 2 codes usually don't are not billable, in the sense that they don't, now these codes, whatever codes you select in the CPT codes, they will be assigned some value. Okay, financial value. That's the reason, that's how you will be able to understand how much reimbursement is to be paid to the physician, right? But category 2 codes, they don't have any financial value. Okay, they are just for increasing the quality of the services. Okay, and if there is a category 2 code that needs to be selected, you need to select that. If it doesn't mean that if it's not going to help in the reimbursement, that you're not going to select. You are going to select if there is a need for it. Okay, so that is your category 2. Category 3 codes. Now, what are category 3 codes? Any new technology, services, treatment. Now, healthcare is always improving. There are always innovations. Okay, so if you've if you bring some new drug in the market, okay, so you want to put it into clinical practice, or any new method of surgery, or any new equipment, anything. Okay, so that now whenever these things are coming into the public, for the public to use it, okay, so it is there for some time to understand how well we can utilize in the daily practice. Okay, so all these things come into picture only after the clinical trials are done. But clinical trials are only based on sample. Okay, only a few number of people are selected and you do clinical trial. In that, if it is like safe and if it is safe and it's not harmful, hazardous to the treatment and all, then only it is brought to the clinical practice. Okay, but even after, so those are only a few set of people. When you come to the actual scenario where you have daily in different types of patients coming in and coming out, you get a little, you understand how well is that drug performing in the masses, right? Like Ozempic, the recent Ozempic, the medication which has come up. So earlier, when it was launched for as a diabetic medication. But now it is more of a weight loss medicine, right? So this is how it happened. So when Ozempic also came, it came after FDA approval only. Okay? But how it is performing in the general masses, you get the actual picture. So that's the reason why now sometimes it has passed the clinical trial, it has come to the general clinical practice, but it is not proving that efficient in the general clinical. Okay? So then we discard that treatment or service, whatever. Okay. So that's the reason why whenever a new service, medication, equipment, whatever is launched, okay, it is not directly put into category one. Okay. It is seen for 5 years. How it is, 5 years is enough to judge whether a certain treatment, drug, whatever, is suitable for the masses. Okay. So that's the reason why it is kept in category 3. So for 5 years, it is checked how it is performing if the particular drug or service is useful. If it is useful after 5 years, it will be shifted to category 1. If after 5 years it's not proving beneficial, it is discarded from category 3 itself. Okay. So because of category 3, there are not lot of what do you call chaos in category 1. Okay. Otherwise, every 3 months you'll be removing codes, you'll be adding codes. Like too many codes, changes will be there to be done in category. So to avoid all this miscommunication or any chaos in category 1, your category 3 is there. So we place the course in category 3 for 5 years, judge how it is, see how it is performing, and likewise, it is after 5 years, either it is discarded or shifted to category 3. Okay. Now, category 3 codes, again, there are 4 numbers, and the last is the letter T. Okay, so this is how you check for category 3 codes. So there will be like 1000 and T. Okay, capital T. Okay, so category 2 is letter F, and category 3 is letter T. So here are some of the examples of CTP codes. 99214 can be used for office. So all are numericals. Okay. 90716 can be administered, used for administration of chickenpox vaccine. 90658 can be used for administration of flu shot. 99397 is used for preventive exam for the age of 65. 12002 healthcare provider stitches a 1 inch cut on your hand. Okay, so see, you have a variety of codes. So it's diagnosis is the ICD, and we talk about CPT is a range of whatever you do in the treatment services. Okay, whether it be a vaccine, it could be a minor surgery, major surgery, preventive exam. Okay, 866-87635 can be used when you are given a COVID-19. Okay, so all that. So we have 6 chapters, okay, evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, and medicine. So these are the 6 chapters in the category 1 of your CPT codes. Okay, so evaluation and management, office visits, consultation, anesthesia, all your sedation and surgical, surgery, any surgery, general, orthopedic, cardiovascular, any surgery, any surgery. Radiology is your X-rays, MRIs, CT scan, ultrasound. Okay? Pathology is all your lab where you take your blood or any fluid for examination or tissue biopsy, all that. Okay. Medicine is any apart from surgery and evaluation management, any treatment you are giving is in the medicine. Even your vaccinations come under medicine. Okay. All non-surgical treatments. So to accurately do your CPT coding, know your latest updates. So that is what we've already discussed. You need to have a detailed documentation. You need to know your latest updates, okay, in your CPT codes. Use code books and resources. Code to specificity. Be as specific as possible. Seek clarification. If there is some doubt in the documentation, if something is missing, or supposing like ultrasound is written, ultrasound of abdomen, but there is no attached report of the ultrasound, or if the report is there, there is no attached images. So you can clarify why is it not done. By mistake, the physician forgot to upload it. So he will upload it. Okay. So likewise, any clarification, if you feel or you need some clarification in selection, some code, okay, that also you can seek either from your managers or colleagues. Whoever. Compliance awareness, you always need to be compliant with the guidelines, the coding guidelines, the HIPAA guidelines. You need to be aware, you need to always be compliant with all your guidelines and collaborate with providers. Always have a good communication with the provider. Okay, so if there is some documentation error, or you feel that you need to select some code or not, so it's always good to have a good communication with your providers. These are the common CPT codes for physical therapy. Physical therapy is same as physiotherapy. Okay? So you can have so many codes. You can have therapeutic exercise, mechanical traction, neuromuscular re-education, therapeutic activity, SLP, treatment individual, electric stimulation, electrical stimulation, Medicare, non-wood. Okay, we have so many. Ultrasound, phonophoresis, PT evaluations. We have so many codes for hot and cold packs, self-care home management, vasopneumatic device. Physiotherapy is not just only for musculoskeletal, it can be used for any organ also. Okay. Cardiac also, for cardiology also, it's used for pulmonary, it's also used. Manual therapy, group therapy, gait training, massage therapy. Okay. Aquatic therapy and exercises. So we have so many in physical therapy. Chronic management CPT course. So here we have different codes. 99490, patients with 2 or more chronic conditions. So whenever we talk about CPT codes also, we always have time, duration also, which is taken into account. Okay. So if it's so whenever a physician sees a patient, okay, there will be a time mentioned, 15 minutes, 20 minutes, 45 minutes, 10 minutes. Okay. So according to time also, you need to select your codes. Okay. So it's a chronic condition with 2 or more chronic conditions and 20 minutes of non-face-to-face time monthly. So it's basically a virtual. Okay. So you can select 99490. Patients with 1 or more chronic conditions will, in addition to code 99490, for every additional 20. Okay. So 20 minutes basic non-face-to-faces 99490. If it's not that 20 minutes and the physician will say, okay, now cut off your 20 minutes over. Physicians don't do like that. Patient might have some more queries, okay? So it might go for more than 20 minutes also, okay? So if it's any additional 20 minutes, okay, then you can have this code as an additional. Now, patients with 1 or more chronic conditions, first visit. Okay, this is the first visit. And 30 minutes of face-to-face. Okay, the patient is there in front of the physician, and it's again chronic. First time the patient is coming, can take 99491. Patients with 1 or more conditions, subsequent patient, that is a follow-up. Okay. Again, bill in addition to 99491, in addition for any additional 30 minutes face. codes. Okay? So like that, you need to understand what is the, so apart from just taking the treatment and services, even this is considered into CPD. Okay? Whether it is the first time, how many minutes, is it face to face or virtual? Okay, everything is considered. So if you see, if you here also, if I have to take a consultation, if I'm taking face to face consultation, my consultation charges will be high. If I'm taking a virtual consultation, my consultation charges will be little low, right? So that's the reason why we need to select all these codes so that we can rightly do the reimbursement to the physician. Okay, so it shouldn't be that the patient is paying more than he should be paying. Okay, so he's paying same for virtual also and for visits also. It shouldn't be that. Understand? So that's the reason why selection of all these codes is also important. Office visit scenario, patient visits the physician for routine checkup and hypertension management. Okay? So it's a routine and hypertension. So 9921 for established patient, moderate complexity visit. Okay? So it's an established patient means the patient is already coming, like comes for follow-ups. Okay? A new patient or a new visit is first time the patient is coming. Establishes patient is already my patient and he comes for regular follow-ups. Okay? And moderate complexity because hypertension management. So that's all about the CPT codes. And we have almost 1,200 courses, 1,840 plus trainers, 4.7 lakh plus learners have learned from us globally. And international certifications are there from Dunster Business School and Florida Institute of Science and Management. That's all about your mastering of CPT codes. Thank you.